Yesterday, we told you about a Colorado woman whose misconception about cancer screenings nearly cost her her life. In 2022, Janine Tapia was diagnosed with stage 4 vulval cancer. It is a rare gynecologic disease. Tapia says she received the diagnosis after her first pelvic exam in more than 10 years. So that got us thinking. We should talk about when we should be getting those screenings and how often.
Yeah, so we brought in 90s medical expert Dr. Payal Kohli to break all of this down for us. Dr. Kohli, thank you so much for being here.
Good morning.
So talk about the misconceptions surrounding getting exams as you get older.
Yeah, it's sort of a catch-22 if you think about it, because as we get older, obviously our risk for cancer goes up because cancer is a disease of aging of our cells. But on the other hand, the benefit of screenings actually goes down because your life expectancy is more limited. And sometimes you can create false positives, things that end up being nothings, but you have to chase them. So when it comes to our older population, we're really sort of scratching our heads about when should we stop screening? Who should we stop screening? Should it be personalized or individualized? And I think that leads to a lot of confusion, not just amongst patients like Janine, but also amongst physicians, where we don't really know what we're supposed to be doing after the age of 65.
All right, so let's first talk about the gyno exams. I know a lot of women hate them, and they talk about them when you're younger because you're sexually active or whatever, but then there's this misconception that you can really delay them when you get older. So talk about when you should be getting those screenings.
Yeah, a lot of older women actually think, well, I'm not sexually active, I'm not having periods, so I don't need to see my gynecologist.
The same partner,
yes,
all of that.
Yes,
okay.
So this is a huge misconception. In fact, postmenopausal women need to regularly see their gynecologist for a few reasons. The first is because you need to look for postmenopausal changes like vaginal atrophy, bladder symptoms, things that you may not notice if you're not looking down there. So your doctor needs to actually examine and see if something's happening that you might benefit from vaginal estrogen, for example. It might make intercourse more comfortable. Second is exactly what happened to Janine is cancers. Cancers happen as people get older, especially vulvar cancer, which can be related to HPV, but in older women you can also have a non-HPV version, which means you may have had normal paps all your life, but you can still develop this cancer because as our immune system ages, it gets less good at fighting the cancer. So cancers can wake up that would otherwise have been senescent when we were younger. So screening for ovarian cancer, uterine cancer, vulvar cancer, that's really important as well. And then thirdly, of course, looking for something called prolapse. So as we age as women and men, but women especially because the shape of our pelvis, our organs can sort of sag a little bit. The pelvic floor becomes weak, those muscles, and you can get bladder prolapse, uterine prolapse. You can actually have organs coming out of the vagina.
What about men? You were kind of talking a little bit that this applies to us as well. How often should we be getting screenings?
Yeah, so men, prostate cancer screening, for example, that's a big question mark. They say after the age of 65, have a personalized discussion. For colon cancer, for men and women, they say after 75, if you've had normal colonoscopies, don't get them anymore. So to me as a physician, it's a very individual decision, but I tend to be on the more aggressive side because our life expectancy has now, for some people in the 80s, some people in the 90s. And screening somebody for a cancer that you could potentially cure can significantly impact their life expectancy in the 60s. So I would say if you're a man over the age of 65, talk to your doctor. If you're healthy, you probably should still be getting those colonoscopies and those PSA screenings as well.
So looking more broadly, talk a little bit about age-specific screenings.
Yeah, so this is something we can never start thinking about too early. So under the age of 21, we don't generally screen because the risk of cancer is a little bit low. In the 20s and 30s, our exposures are sex and sun. So we screen for cervical cancer and skin cancer. And then in our 40s and 50s, we look for breast cancer, prostate cancer, and colon cancer. But the caveat here is there's lots of cancers we never screen for. Stomach cancer, pancreatic cancer, leukemia. So you guys have to have your own radar up at all times. The other caveat is that because cancer is occurring younger and younger, many of these guidelines may start to change, so make sure you stay on top of it. So if you have a family history or something, you may even need to start a decade earlier, like for colon cancer. If you have a first-degree relative who had colon cancer at 45, you'll need to start at 35, a decade before they had it.
What about over the age of 65? What is the downsides and the upsides to doing that?
So the downsides, as we discussed, are, that you'll find false positives, that you're going to put people through medical tests like a colonoscopy, which is an invasive test, which could lead to complications because your risk of complications goes up as you age without necessarily saving their life or making them live longer because the benefit is less. But again, to me, the upside is that we need to be smarter than the cancer, and we actually need to think about starting to screen people in a regular fashion, even over the age of of 65. So if you're someone who's older and you're not sure, this is a really great discussion to have with your doctor, because I think these are the most common solid cancers that we screen for, but there's many others out there. I also am really excited about research that looks at genomics and looking at your risks, like looking at your genes and predicting if you're going to go on to get cancer through a blood test, looking at your blood test now and predicting if you're going to get cancer. So I think that's where we're headed with cancer screenings.
Real fast, one thing that Corey and I were talking about too, especially on the younger side of things, is we would love to get screened earlier. Insurance makes that very difficult, to be entirely honest. What are factors that we can get our insurance to work with us on getting those screenings earlier?
Yes, I would say a few things. One, AI is really good at writing appeal letters for insurance. Okay. And so if you have gotten a denial and you think you need to get a screening because of family history or because of increased risk or genetic syndromes or what have you, a lot of my patients, and myself included, type it into AI and it helps us generate that appeal letter that actually helps it to get through. But I would sit down and look at your past, look at your family, look at your genetics, look at your exposures and risk factors, because there are young people that may have been exposed to asbestos, for example, and they may need special screening, whereas it doesn't necessarily apply to the population. So make sure you put in all the possibilities that the insurance company could consider and really make a case for them as to why screening you, which costs a little bit of money, is worth saving you from getting a cancer, which costs a whole lot more money.
It really is unfortunate sometimes, but you have to be your advocate. You have to speak up. You have to be vocal about it, because like what you said, I mean, getting that screening now can prevent a lot down the road.
Yep.
Well, and I'm just really nervous about this trend of young people tanning themselves, which has become so popular now.
Again? People are tanning again? I thought we did away with that.
It's back.
I thought people were spray painting themselves.
We're going to talk about it at 3 o'clock today, but it's part of Make America Healthy Again.
Oh,
it's this trend to have the sun-kissed look, and you're supposed to go out when the UV index is the highest, because that creates the most amount of tan lines. So these types of social media trends and misinformation, to me, are really concerning. So I'm just glad we're having this conversation, because cancer is here and we haven't beaten it yet, and we really need to stay ahead of it.
You're talking about in the sun, not in the bed, right? The tanning bed. The tanning beds aren't coming back, or is that too?
That as well, because tanning is healthy, supposedly.
Okay. Show them Final Destination 3. They won't do that ever again. Just saying, Dr. Kohli, thank you so much.